Hi, welcome to the section of cardiology. This is Dr. Jaitly. In this section particularly, I'll be talking to you about the basics of what are the types of heart failure. I know we have discussed the causes of heart failure in my previous video presentation just now, and here's an exhaustive list as you see on the right panel, very colorful, obviously trying to see if you could see the standing out causes, the myocardial, the systemic, the infiltrative, the infection, the one pregnancy, and of course related to the lungs, the valvular, the high output failures, certain poisons like alcohol and smoking, arrhythmias, familial, and of course the ones where you can't find the cause, which is always a waste paper basket diagnosis type of thing where you can't find the cause after you've ascertained all the above lists. So, which is a significant category, by the way, just so that you know. So now, what do we connote? What do we imply when we say forward versus backward failure? Now, scientists and authors have propounded various theories and say, look, the heart failure could be because it's a continuously pumping organ and it's a closed circuit where the blood is returning back here on the right side for oxygenation, and then once the oxygenated blood comes back from the lungs, then again it's pumped out. So it's like a complete circuit. You know, the blood is going round and round throughout the body, every minute of your body, literally, of your life. So the whole idea is wanting to see, you know, the authors have tried to understand the philosophy, whether it is a forward failure or is it a backward failure, because it's moving in the forward direction. So people would like to know whether the failure is because of that the heart is not able to pump forward, or is it because it's a backward failure that's backing up, in other words. So numerous terminologies have evolved. So I think the understanding is that forward failure implies that there is an obstructive pattern. Say the aortic stenosis, that's a good example here, like in AS as have I shown you here. So that's a forward type of failure. And a backward failure would be where there is mitral regurgitation of a severe nature, so the valve just sends the blood backwards into the left atrium, then into the pulmonary circuits, and then into the lungs. So there is a backward type of failure here. So when the blood is returning back regurgitantly, I think one could call it a backward failure. If it's not, it's failure to send it forwards will be an obstructive pattern. Like in mitral stenosis, for instance, where the mitral valve fails to open and is very narrow. That would be a forward failure, but also a backward failure in a way. So these are very, very, different terms people have used, again, to define the types of heart failure one is encountering. Right-sided failures versus left-sided failures here. For instance, look at the right-sided failures are here, which are involving the RA and RV, and that's typical in smokers or lung conditions. Those are called cor pulmonale. And the left-sided failures are normally the valvular or ischemic or valvular on the left side per se, or even hypertension, for instance, diabetes. They're all left-sided failures predominantly. And of course, the viral and idiopathic, the postpartum, they're all involving the left ventricle. So those are the ones where it's the left ventricular predominance where there is a failure. But then eventually, once the failure goes to the right side, it's called congestive heart failure, a little more confusing term here, where all the four chambers are involved. So that's called the congestive heart failure, when you have right side and the left side both involved. Then you have low output versus high output failures. Now, 80 to 90% of the failures are low output, we know that. But high output failures have their own category. And those are the ones where there's a high demand, like in thyroid, hyperthyroid cases, or patients who have intracardiac shunts, where there's cyanosis, or blue fingertips or nail beds. That's called cyanosis. So those are intracardiac congenital conditions. But extracardiac, like in patients who are on renal dialysis, and they have a port called an AV shunt, etc., where the dialysis machine points are attached, there's an external shunt. So these are high output failures. And then you have the compensated versus decompensated. Now that speaks of a pathophysiology of the person, because a lot of the times, if the patient is being treated with heart failure medications, it's called a compensated failure, and the patient can still lead a meaningful life, relatively, not as exuberant like a normal left ventricle person, but obviously a person who has a decompensated left ventricle, but still a compensated form of a failure. I know these terminologies are a little more confusing at times, but the point I'm making is if you're on a treatment for the heart failure, for instance, you could be called a compensated failure, and the patient can still walk around, sleep fairly well, does not seem to be requiring oxygen, and can go to the doctor periodically on a month-to-month basis and have his medications checked, have his heart checked, etc., etc. A decompensated failure implies that when the patient shows up at the hospital or in the emergency room or at a doctor's office, where the person is now changed from the previous status, where he or she was able to walk a few blocks, now is unable to walk or is short of breath even at rest, or cannot even lay down, etc., etc. So that's a worsening form of heart failure, and that failure could be from any of these causes, obviously, regardless of what the cause is. So they could be compensated versus decompensated in that category. Okay, I thought this would be interesting, and let's discuss more on my next presentation as we go along. Keep tuned.